first talk, we have Reconstructing Invariances of CT Image Denoising Networks using Invertible Neural Networks by Elias. How do I say the last name? Eulig?
Eulig.
Eulig.
Thanks. Thank you for the kind introduction. And let me start with the motivation. So as we all know and also have seen during this conference already, recently deep learning-based methods have shown quite impressive performance on many tasks in medical image formation. And just to name a few, there is deep learning-based reconstruction, deep learning-based scatter estimation, deep learning-based image noise reduction, and the latter will be the topic of this talk. Now, we also know that results of deep learning-based methods often excel those of conventional algorithms, both qualitatively and also quantitatively. However, with most neural networks being black boxes, they usually are notoriously difficult to interpret, and recently concerns about their robustness and safety, particularly in a clinical setting, have been raised. And this is even more so the case with recent advancements in generative modeling, such as VAE and GANs, as we've just seen actually, which may produce extremely realistically looking results, which nonetheless are possibly wrong. Now, in this talk, we do not want to focus on the denoising performance of the networks. Instead, we want to lay fundamentals for post hoc interpretability and robustness analysis of the denoising networks. And more specifically, what we want to do is we want to investigate what the networks have learned to represent and what they learned to ignore, i.e. their invariances. Now, deep learning-based CT noising basically always aims to minimize some difference between a high-dose image and the output of a function f, which receives the low-dose image as input. And this function f is now realized by CNN with parameters theta. Now, while our method is architecture agnostic and in principle applicable to basically all denoising architectures, but also to different tasks in medical imaging, such as metal artifact correction, and also to different modalities like PET or MR, we will here focus on two very popular networks. The first one is like a vanilla CNN, like a 3-layer CNN trained with a pixelwise loss in image space. And the second one is a bit more sophisticated network structure trained in a Wasserstein-Garn setting together with a perceptual loss. Now, given such a pre-trained network F, we can now seek to analyze its internal latent representations at some layer, which we denote now Z. And we do so by decomposing this function f into basically two functions. And the first one is phi, which is everything that leads to that latent representation z. And the second function is psi, which is everything that comes thereafter. And now please note that, of course, we can choose this phi and psi. So basically we can have different, we can choose different latent representations at different depths in the network. Now, to reconstruct which information of the input image is captured in this latent representation Z, what we do is we train a VAE, which learns a complete data representation of the input data. And to improve the reconstruction of this VAE, we train it in a Wasserstein-Garn setting, and we train it on smaller patches instead of full reconstructions. Now here, again, please note, of course, a similar VAE could be trained to map high-dose images to high-dose images. And we will do this, and by this, we would get a complete data representation of the high-dose image data. And we will come to that in a second. Now, given such a complete data representation Z bar, what we will ask ourselves is basically what information of Z bar is already captured in Z and which information is not captured in Z. These are the invariances. And we do so by learning a mapping T. So T has that bar as an input and is conditioned on our latent representation Z, and it learns a mapping to those invariances. And without loss of generality, we assume that the space of invariances is normally distributed. And now, if we have such an invertible neural network, or basically T is now realized by an invertible neural network, so that we can sample later doing inference and generate new invariance images. And in order to be it invertible, this is basically the main structure of an invertible neural network. So you have a sequence of invertible blocks, and as the name already suggests, so each of those blocks is invertible. So once we trained this network, what we can do is we can generate new Z bar by sampling simply from a normal distribution, applying the inverse mapping of our Ci and N. And then we can use this new generated Z bar, feed it through the decoder that we already trained for the VAE anyway, and we can then generate invariances in the image space. Now, about the data set that we used the low-dose CT image and projection data set from the Mayo Clinic, which is comprised of 50 head, chest, and abdomen scans, and reconstructions of size 512 times 512. For each scan, we have already simulated low-dose acquisitions available at 25% for abdomen and head and at 10% for the chest. During training, we use a weighted sampling scheme such that slices from each patient were sampled with equal probability, and hence also slices from each anatomical site. Now, to make everything be quite comparable, what we will do is we use the same training, validation, and test split for each of the denoising methods that we trained, but also for our invariance reconstruction method. Okay, so this was quite a lot. So let's have a brief summary. So first, what we do is we train those denoising methods as proposed in their respective papers. Then we train a VAE, which learns a complete data representation of the low-dose images. And then what we do is for each denoising method and each layer in the network that we wish to evaluate, we train a separate CINN to recover the invariances. Note that, of course, the VAE can remain fixed because the complete data representation of the low-dose images is still a complete data representation of the low-dose images, and of course, independent of the latent representation that we wish to analyze. Then for a given test image, we can sample n invariances. Here we chose n to be 250. We apply the inverse mapping of t to each of those sampled invariances, and then the pre-trained decoder to get those invariances in image space and not in latent space. And then one other thing that we did is now we can also visualize those invariances in the high-dose image domain. And how to do this is basically just train a second VAE, which learns a mapping of the high-dose images and thus also a complete data representation of those. Okay, let's look at the results, and we start with the denoising. So the first row, we can see the low-dose images, and in the second row, we can see the prediction, and the last row, we can see the high-dose images for the Chen et al. Network, so basically the vanilla CNN with a pixel-wise loss. And we can already see that, okay, maybe from far away it's difficult to see, but we can see that there is quite a good denoising performance. If we zoom in a little bit, we can see, okay, in fact, the network did perform quite a good denoising here, but we can also notice two other things. So the first thing is kind of obvious. We see the blurry results, and this is, of course, simply due to the pixel-wise loss in image space of the Chen et al. Network. The second thing that we notice is that the network is not able to reconstruct all the structures that we see in the high-dose image correctly. And we can see that some of the structures are altered or sometimes even more or less completely different. We can see this here with the lung tissue and with the bone structure. Now, if you have a look at the results by Yang et al., again, we can see quite a good denoising performance. And if we zoom in a little bit, we can now see that, of course, here we have much more of the high frequency information, especially we also have a realistic noise in the data, right? And this is, of course, just because we trained this network in Wasserstein-Gahn setting and with a perceptual loss. Again, we can also here see that the network is not able to reconstruct all the structures that are present in the high-dose image correctly. And still and this is now the important thing, of course, here the results, they look very convincing. If you wouldn't know that this is not how bone looks like, it would be basically impossible to tell. Now let's get to the interesting part. We now want to sample invariances, and we did this here for the Yang et al. Network. And let's first have a look at the left-hand side. So here you can see 4 images. We can see the low-dose input image to our network. We can see the high-dose image Y. On the bottom left, what we can see is the reconstruction of the VAE. And on the bottom right, we can see the prediction of the denoising network, here the Yang et al. Now, on the right-hand side, we analyze now the invariances for 3 different layers in the network. So those are the individual rows. And we show here 5 sampled invariances together with the standard deviation over all samples, so those 250 sampled invariances on the right-hand side. And we can see that most differences are pretty insignificant. One difference, for example, that we can see is in the exact realization of noise, which is, of course, to be expected. But we can also see that there are some invariances in the anatomical structure. And of course, this is much more of an issue. We see here another example of this, where we can see that on the first glance, everything looks fine. But if you look more closely, you can actually see that some of the structures of the lung tissue are just completely different. Now, at this point, I also want to mention that if you look at the reconstruction of our VAE, you will notice that also here, the VAE apparently did not learn such a complete data representation as we hoped for. So while the result looks extremely realistic, again, because it was also trained as a GAN, you can see, so if you have the ground truth right next to it, you can tell that this is of course different. So what this means is that some of the invariances that we sampled here actually might be due to the VAE, and we might overestimate basically the invariances of our denoising method. Now, up to now, we only looked at the sampled invariances in the low dose image domain. And of course, something that is very interesting is now if we look at those in the high dose image domain instead. And that's what we trained the second VAE for, that learned complete data representation in the high dose image domain. So we did this here now for the Chen et al. Network, and we only did it for the last layer simply to stay in time. And on the left-hand side, again, you can see the input, the high dose image. You can see the reconstruction of the VAE, which is of course now in the high dose image domain, because that's what we trained it for. And you can see the reconstruction of the Chen et al. Network, which is, of course, again, a little bit blurry simply because of the pixelized loss. In the center, you can now see 8 sampled invariances for this last layer of the network. And you can see that most changes are, again, pretty insignificant, but there are some differences in the anatomical structure. And something that you can see here is that the reconstruction by the denoising network actually introduces some errors with the bone. And those errors are not necessarily, or in most of our sampled invariances, in fact, they are not visible. On the right-hand side, you can see the expectation over all sampled invariances. Again, there you can't see this structure, and you can see the standard deviation. This is another example where we can see that the denoised image, again, has like this open bone structure. And you can't see this structure in the sampled invariances, or at least not in the ones that we sampled here. And you can't see it in the expectation neither. Now, to draw a conclusion and to give an outlook, we've seen that both denoising networks perform similar as reported in their respective paper. We saw that the Yang et al. Network produces more realistic results compared to the Chen et al. Network due to training in an adversarial setting, as expected. And we've seen that both denoising methods are invariant to some anatomical features, at least to some extent. However, we also saw that an incomplete data representation learned by the VAE may explain some of those sampled invariances. So to give an outlook, first thing, of course, we should improve the interpretability by improving this embedding Z bar. So essentially, one option could be train a better VAE or come up with another method that does a better job in learning such a complete data representation. The second thing is we could try to make our method or make what we see more interpretable by mapping the sampled invariance images to a semantically meaningful space. So right now, we always looked at those high dimensional image data. And of course, it's difficult to look through like 250 of those sampled invariances. But if you would sample now one of the latent spaces to a semantically meaningful space, then you could basically go to a much lower dimensional space that also is more interpretable simply because it's semantic. And one last thing that we can do is we can try to minimize undesired invariances through fine-tuning of the pre-trained denoising method. So what are undesired invariances? Or first of all, what are desired invariances? So desired invariances, I think, depend on the task a lot. So in this example here, for example, one desired invariance that we in fact also saw that the network show is with respect to the exact realization of the noise, of course. But one undesired invariance, for example, would be change of the anatomical structures as we've also seen it. And with this, I'd like to say thank you, and I'm happy to receive your questions.
We have time for questions. Maybe I can ask.
Sure.
I was wondering, you were showing these images obtained by sampling the invariances, and instead of visually looking at them, do you have like a metric that can be used to compare the different images?
Yeah, so that's definitely one of the issues that we have right now. So one thing that you could of course do, and that we're also working on, is you could start clustering those images, right? And you could see what are the main differences between those images. And one other thing that you can do is then like mapping it to some other space that is just more interpretable. So for example, semantic space.
Thank you.
I had a question. So you showed some examples where some of the structures were missing in the denoised images, right? Were there cases where you actually saw pseudo structures that is not in the high dose image, but shows up on the denoised image?
Yeah, so that's also something that you can see. So I think we didn't see those in these examples, but specifically with GANs, that's definitely something that that you can see quite often. Yes.
Thank you for the talk. Very interesting. So in an outlook of your work, you mentioned that you're going to fine tune the desirable, so that the desirable invariance can be preserved. So I was wondering if it is related, so-called attention-aware UNet people are using outside. Do you think that has a certain relationship with that kind of technique?
Yeah, so the question with introducing attention is always, what do you supervise it or not? And I think if you would supervise this attention, that's then again like going into some having some task related thing, for example, then I think this supervision actually may help and this attention may help. However, with self-supervised attention, I'm not sure that you can, or at least per se, you don't know what exactly, or if this is actually helping for the task at hand, and if this actually or if this makes things more explainable, to be honest.
So there's a difference.
Yeah, I think so, yeah.
Thank you.
Maybe a last question I had, which is, you looked at the low dose and the high dose invariances separately. Have you looked at sort of making, constraining the representations together in some way?
No, not yet. But yeah, that's for sure something that you could look into. Yeah.
Okay, thank you.